Hello guys, good morning. Today I'm going to talk to you about signing up for Medicare at age 65 when you're eligible for Medicare, eligible for Medicare. First thing you need to know is when you're first eligible to sign up for Medicare, you have a couple of choices to make. You can choose between staying with original Medicare or moving to an Advantage plan. You'll hear Plan C or Advantage plan. You'll hear terms like supplement or Medigap plan, which refers to original Medicare. Keep in mind, original Medicare and moving to an Advantage plan, there are two different options for you. Now, good or bad, it's up to you. Now, the choice you have to make will have some nuances, okay? So if you decide that, listen, I want to stay with what my parents had, original Medicare. I would like to stay in the Medicare system, okay? Then when you make that choice, you're choosing a supplement or Medigap plan. Now, think about it. When original Medicare, Parts A and Parts B, okay, you will automatically, if you're on Social Security, if you're collecting Social Security, you automatically be sent out a Medicare card, your red and blue card, Medicare card, which are your A and B. A is for hospital, B is for everything else, hospital, doctor visits and all that okay? So think about it. Okay, original Medicare only covers about 80% of your Part B expenses, okay? So think about it. You've got 80% of your Part B covered. Your Part A is your hospital, so that's covered. And there's some nuances to how that's covered, but you have your hospital visits, okay? So, okay. So now what you have to make a choice about is the other 20% of whatever expenses are left over from your Part B coverage, okay? So that's when you make a choice between original Medicare, staying in the Medicare system, or moving to an Advantage plan. Now, why would you make that choice? Why? What are the differences? Okay, here are the differences. Original Medicare, you remain and continue in the Medicare system, okay? Which means everything that you do, you will communicate with Medicare, okay? So whatever questions you have, everything will go through Medicare, okay? That's when you choose your part. You've got your Part A, Part B, and your supplement or Medigap plan. Now, your Medigap or supplement plan will still be with a private insurance company, but it's all administered by original Medicare in the Medicare system. So any problems you have, you go through the Medicare system, okay? Now contrast that with if you choose to go into an Advantage plan, okay? When you choose an Advantage plan, you leave original Medicare and the Medicare system and you move to private companies, okay? The private company will manage and handle your Part A and your Part B, plus your additional coverage, which will be your Part C gap coverage, okay? Wouldn't be Medigap, but it is considered gap coverage, your 20%, okay? Now, if you stay in original Medicare and you choose a Medigap or supplement plan, there's a premium that goes with that supplement plan, okay? So think about it. You've got your Part B premium, which is deducted from your Social Security. And then you've got, when you're choosing a Medigap plan or supplement plan, you've got your Medigap or supplement premium, okay? And then you've got to choose your Part D, your drug premium. You must do it when you're originally eligible for Medicare, okay? When you're first eligible, you have to choose it then. If you don't, there's a premium, and we'll talk about that. There's a penalty involved with not choosing your Part D plan when you're first eligible for it, okay? All right. All right. So there are your choices. Now, what are some of the implications of those choices? Everything that your Medicare pays for in your Part A, Part B, your plan covers. Okay, your supplement plan or Medicare plan covers. If the doctor recommends it, Medicare pays for it, then your supplement plan pays for it. Now think about that. If it's recommended by your doctor, Medicare pays for it, your supplement plan has to pay for it, has to cover it. Okay, whatever it is. Okay. Now, if you choose to go into an Advantage plan, though, again, remember, you're moving from the original Medicare system to a private company system, managing your Part A, Part B, and your C plan, okay, your Advantage plan. And what they have is the ability to deny claims, okay? They can, which is a part of most, if not all contracts, is the ability for the insurance company to require pre-authorizations for any recommendation from your doctor. Okay, so it has to be pre-authorized, and they have the ability to deny it if it's not authorized. They do not have that ability in original Medicare, in the Medicare system, supplement or Medigap plan. Okay, now the reason that most people, I would say, choose to go to the Advantage plan as opposed to original Medicare and stay in the Medicare system is cost. A lot of the time it's cost and convenience. Okay, so the original Medicare upfront costs you Part B premium and your supplement plan premium, your Medigap premium, plus your drug plan premium if there's a premium. Sometimes there's zero plans, plus your dental, vision, and hearing. Okay, you move and you look at some of the Advantage plans. They're zero premium, so the only thing you have when you choose an Advantage plan is the premium for your Part B. Okay, most of the Advantage plans will include vision, hearing, and dental. They'll also include a zero premium. Okay, so that's attractive. Now let's look at what you get in they'll usually include higher deductibles, higher out-of-pockets. So you have lower upfront cost, like doctor visits, routine doctor visits, and things like perks, like gym memberships, and maybe some over-the-counter benefits, cash cards in your Advantage plans, but you'll have higher deductibles, higher out-of-pockets, and the back end. In your supplement plan, original Medicare, when you stay in original Medicare system, you'll have higher out-of-pockets up front, maybe, and you'll have a low deductible. The max out-of-pocket between $200 and $300 for right now, this is 2026, between $200 and $300. So think about it. If you have a $300,000 bill, the most in 1 year you will pay out of pocket will be a max of about $300. In original Medicare, everything is covered. In the Advantage plan, the max out of pocket in 1 year could be $10,000. Okay? So when you're looking at these plans, if you're choosing these plans, and I imagine most people choose these plans because it's cheaper for them to have an Advantage plan because it's zero premium and they can't afford to have another $100, $150 deducted from their Social Security in addition to their B premium. So they choose the Advantage plans. But I'd say when you look at these plans, make sure you're getting what you need out of it, okay? Original Medicare has no boundaries. If you're living in anywhere in the country, okay, you can move from state to state. Your original plan, you'll hear F, G, N. Your original Medicare system plan will follow you wherever you go. Okay? Now think about that. It'll follow you wherever you go. So you don't have to change plans every time you move. Okay? With the Advantage plan, each time you move to a new zip code, your plan may have to be changed, because the plan that you have in one zip code may be different in offering, or a different plan offered in another zip code, or not available in that zip code that you're moving to. So that's another thing to think about. So when you have to move, and then think about your you have to look at which facilities will accept your Advantage plan, the plan you have. Now, in Original Medicare, anybody that accepts Medicare accepts your plan. That's Original Medicare, the Original Medicare system. Any medical facility, a doctor's office that accepts Medicare accepts your plan. With the Advantage plan, there are some plans that some doctor's offices or doctor's facilities won't accept. Okay? So those are kind of the things that you have to think about when you're choosing to go from Original Medicare, stay in the Original Medicare system, or moving to an Advantage plan because of the zero premiums and the perks. Now, not to say, and I would not say, one is good and one is bad. Original Medicare, if you can afford it, is I think it's a very good, it's the best healthcare coverage you're ever going to have. Now, it's a bit confusing because you have to choose and manage separate things. Your supplement plan, your dental, vision, and hearing plan, your drug plan is separate in Original Medicare, in the Original Medicare system. Those are packaged for you in your Advantage plans. So it's simpler to manage in your Advantage plans. Okay? Now, you have a ton to choose from. A ton of Advantage plan companies to choose from. Look at the company carefully and make sure that the company is sound. I mean, most of them are, because they're all managed and supervised by CMS, Medicare. Okay, they're all contracted with Medicare, so they're all really rated by Medicare. Okay, so a lot of you'll hear, my neighbor had this plan and they got this, and my neighbor had that plan. So don't go by what your neighbor has, because if your neighbor lives in one zip code and is eligible for one plan that's even the same company, it's not the same as the plan that's available in your zip code with that same company. Okay? So it's not the same. So you have to look at the zip code you live in. And these are Advantage plans now, Plan C's. You have to look at the zip code you live in, look at the plans that are available in your zip code, and look at what those plans offer in your zip code. You have to look at the different state. If you're in another state, you have to look at the plans in your state, in your zip code, and see what those plans offer. And those are different than your neighbor in another state, in another zip code. Okay? Now, again, with the Original Medicare, and I know this is so confusing, even in trying to explain and simplify it, it's so confusing. But in Original Medicare, with your supplement or Medigap plan, which you'll hear, it follows. A G plan is a G in Oregon, the same G plan as in Georgia. In every state, the G is the G. The N is the N, the F is the F, or you got A, B, and C. They're not the same C as the Advantage plan, but those plans are consistent along throughout the states because the original Medicare, which is a federal program, and you stay in the original Medicare system. Okay, so when you move out of the original Medicare system, when you make your choice and you decide you want to go into an Advantage plan because of various reasons, all the perks, the cash cards, or out of the over the counter, the silver sneakers or gym memberships or a package, vision, hearing, and dental, whatever you choose, you make sure you understand that you're moving from the original Medicare system, original Medicare, to a private company, which operates a lot differently, okay? It operates a lot differently, and they're allowed to. So just know that when you make those choices. Now, there's a lot that goes into this, because when you're looking at the details of any of those plans, and I'm talking about an Advantage plan, again, the details of a original Medicare G and F plan, the details of those plans are the same. The same G plan, the details are same. There's some subtle differences between an N and a G, but there are major differences between plans in your Advantage plans, okay? There are major differences in the company's C plans in what you would call a chronic plan. You have chronic plans. You have dual eligible plans in which you are dual eligible, where you're eligible for Medicare and Medicaid in that state. Okay, so you're dual eligible. Those plans are different than a regular C plan, just a regular Advantage plan. So there's a whole lot of differences. So you hear all those different terms used, but you'll know what they are. But what I suggest to you is when you're working with someone, and if you want to get advice from me, I'm licensed in Georgia and Louisiana. I'll leave my a link under this video, and all you have to do is look at it, find the link, click on it, give me a call, and I'll explain the nuances of independently, the nuances of all of of what you're considering. Okay, so in your Medicare journey, I think the original Medicare is good. It's very good coverage. It ultimately depends on you as to whether it costs less. Usually it does, but if you look at if you're paying $150 per month for a year and you never use anything, that's how some people compare. I paid all this money and I never need, but I could have saved that money and I could have had the same amount that I had in the Advantage plan in max out of pocket because I had no premium in my my Advantage plan, and I had zero cost doctor visits and things like that. So comparatively, who knows where you're going to save the most money? But when you talk about the ability for the companies to limit the types of services or number of services or number of covered items in your plan, the Advantage plan has more of those. Of course it does, because their contract with Medicare CMS allows them to deny claims and to offer or to ask you to have a pre-authorization. I'm sorry, I don't know why it's so tough for me to get that out. They're allowed to have pre-authorizations in their contracts, okay? Whereas original Medicare, if Medicare covers it, your plan has to cover it, okay? So I will, like I said, I'll explain more of this, and it gets really, really into the weeds of this stuff, but I don't want to say go into too much because it gets more confusing. It gets more confusing the more you explain it. So just leave with this. Original Medicare, the original Medicare system, you'll hear supplement plan or Medigap plan, in which you stay with original Medicare. There's premiums that in addition to your B premium that go along with that. If you decide to go with the Advantage plan, there may be, most likely there's no premium to go along with your plan. There are pre-authorizations that go with your plan. There are a lot of different perks and different things that you package in your Advantage plan that are separate in your original Medicare plan that keeps you with original Medicare and the Medicare system. So hopefully I didn't confuse you too much by the explanations on this stuff. But again, I will be glad to go over that with you if you contact me. And good luck in your journey, guys. Talk to you soon. See you in the next video.